So let's get started. For today's discussion, we'll start off talking a little bit about stigma, data, and opioids, and then moving on to signs of a drug poisoning, and then responding to a poisoning. We'll wrap up with some resources and follow-up. We will quickly go over what stigma is. Fighting stigma is a critical part of fighting addiction. And according to American Health, public stigma is defined as negative attitudes towards specific groups of people among the general public. This is very high towards individuals with opioid use disorder, and it often causes some barriers that keep us from addressing the opioid crisis and finding solutions. Some common myths are that shame is an effective way to prevent or treat addiction, addiction is hopeless, supporting people with addiction encourages drug use, addiction is a moral failing, relapse means a person has failed recovery, and that there may be a right and wrong way to recover. In fact, stigma prevents people from getting treatment. Substance use disorder is a treatable chronic illness. People in recovery need support to fight their addiction. Substance use disorder is a chronic illness that requires physical, mental, and social supports for recovery. Recovery is a long-term effort, and relapse happens often as part of that. Recovery will look different ways according to an individual's particular needs. Again, I can't stress this enough that fighting stigma is a critical part of fighting addiction. So what are opioids? Opioids are powerful drugs that have a risk of a potentially fatal overdose. This includes heroin, synthetic opioids such as fentanyl, and some prescription pain relievers. We've seen a few of the street names for these, but many of them can often be found in our very own medicine cabinets. Now we will go over what an overdose is. An overdose happens when a toxic amount of a drug or combination of drugs overwhelms the body. We'll be covering two different types of overdose today. The first is an opiate or downers overdose. Oftentimes the breathing slows, the breathing stops, or the heart stops. The second is a stimulant overdose. Oftentimes the heart speeds up, body temperature rises, there may be seizure, heart attack, or stroke. Stimulant and polysubstance are our biggest killers related to substance use. There is no current naloxone for those. Naloxone that we will be covering today only works for opiate overdose.